Inhalant abuse, also known as huffing or bagging, starts early and can cause permanent brain damage. It may start when young children discover they like the smell of gasoline and the warm, dizzy feeling they get when sniffing it deeply. Commonly abused items include volatile solvents such as paint thinner, shoe polish, gasoline, and glue. Office supplies such as correction fluid, computer dust-off, and certain felt-tip markers. And gases such as butane, propane, and nitrous oxide. Nitrous oxide comes in several grades. Industrial grade, used as race car fuel, is the cheapest and dirtiest. Next is food service grade, used in whipped cream containers. Medical grade or laughing gas is the cleanest and most expensive. Inhalant abuse peaks between the 7th and 9th grades. According to the Monitoring the Future study, inhalant abuse is declining among 10th and 12th graders, but has increased significantly among 8th graders for the past 2 years. In 2002, there were about 1 million new inhalant abusers. 80% of these were under the age of 18 and roughly split evenly between boys and girls. Inhalant intoxication mimics drunkenness. After a brief period of euphoria, during which the user feels dizzy and may act silly, comes drowsiness and a loss of coordination. Users may lurch around or fall down, increasing the risk of injury. Speech becomes slurred and lethargy sets in, followed by agitation, confusion, or loss of consciousness. Headache, nausea, and vomiting are common. The most dangerous short-term risks are asphyxiation, suffocation, as oxygen is displaced in the lungs, convulsions, and coma. Sudden sniffing death syndrome results from irregular heart rhythms and can occur during the first use of inhalants. Some experts estimate that of all inhalant-related deaths, 40% occurred the first time the user abused inhalants, probably due to some biological vulnerability or abnormal heart rhythms. Solvents dissolve grease and fats, also called lipids, which is what our bodies and brains are made of. Chronic inhalant abuse is among the most difficult of all addictions to treat due to permanent damage these solvents cause throughout the brain. MRI brain scans of chronic inhalant abusers show loss of brain tissue volume and changes in brain structure. A 2002 study compared chronic solvent abusers with cocaine abusers and found that the solvent abusers had far more severe brain abnormalities and cognitive impairments. Cognitive testing shows marked impairments in problem solving, memory, concentration, and other areas of thinking among inhalant abusers, and it has been shown that after stopping all inhalant use, only about 2/3 of lost cognitive functioning returns. Other permanent consequences include hearing loss, limb spasms, and damage to the liver, kidneys, and bone marrow. Evidence of inhalant abuse may be pretty obvious: paint stains on face and hands, chemical odors on breath and clothing, red eyes, and runny nose. Because the intoxication is so brief, children are able to hide what they are doing. It may only take 5 minutes to sneak into the basement, become intoxicated on gasoline fumes, and recover. Be alert for clues such as finding unusual substances in your child's room or drippy whipped cream spray cans. By spraying them in the upright position, the nitrous oxide propellant is released while the whipped cream remains in the canister. It would be impractical to rid your home of all abusable substances, but it is important to know where chemicals are stored. Parents should begin talking with children very early about product safety, poison control, and things that do and do not belong in your body. Parents should avoid using terms like getting high, which sounds attractive and may have the unintended negative consequence of stimulating curiosity. A 14-year-old girl in my teen recovery group described using a store gift certificate to purchase her first can of computer dust-off so she could get high like the girls portrayed in the movie 13. She had just seen the movie with her mother, who hoped it would scare her away from problem behavior. Another example of bad modeling is inhaling helium from balloons to do the Munchkin voice. Even though helium is not dangerous, it is not something that belongs in our bodies and sends the wrong message to children.